Drop this. There it goes. Nice.
Ooh.
So we have Anton here today, and what are some of the spots you want to work on?
Basically, it would be like lower left.
Lower left.
That's like
okay.
very like.
Do you feel it like if you bend down? Do you notice it?
I do.
Bend down right now and point to where you feel it tight.
Well, like
Right here, and he's pointing at L4, L5. Okay, and how about leaning back? Is leaning back worse or not so bad?
Not so bad.
Yeah, so it's more flexion, it's more forward. Yeah. So you got left lower back, what else?
The golf elbow.
Yeah.
My knee a little bit, and my neck.
Okay, so we'll do a little everything.
A little like chest kind of.
All right.
That's,
left,
I mean,
left,
it's,
left.
yeah, but mostly it's my lower.
So we'll start with that first.
Okay.
So I'm gonna have you lie face down. Put your nose right here. And drop your head right there. When I bring your legs up like this, does that bring more tension into this spot?
It does a little bit, yes, it does.
Point to the spot. Yeah, so you're still pointing to L4, L5. All right. So I'm going to put my elbow in there, okay? Am I the first person today to put their elbow in your spine?
Oh, yes.
All right, so you feel that though, right?
Yes.
See, I should probably meet you at the 9th hole. He's a golfer. And just do this for 2 or 3 minutes, and then I'll see you at the end. You can buy me a beer.
Absolutely. Oh,
right there.
Yeah. Ooh, that hurts. Oh.
So a lot of that's muscle. I have some ideas for you too, which could help you a little bit here. I know we joked about it, like, you know, a lot of people don't really take care of themselves, so they're really broken. But you might, because you love for golf so much, you might do this one stretch I'll give you that might be nice for you, okay?
Okay.
Because it might give you another 30 years of golf, you know what I'm saying? Or 30 years of pain. You're going to do the golf anyway, but 30 years of pain-free golf would be awesome.
A lot of people stretch before golfing, and
Yeah.
I honestly don't.
Well, it's not even for stretching at the golf. It's what you can do at home to just dig this muscle out. It's something you lay down on, it'll dig in your back. But how does that feel now? Just hitting the muscle. So I didn't adjust anything. I just squished the muscle a little bit. A little looser, right?
Yeah.
A little bit. Lift this leg up, but keep the leg long. So you're going to lift from the thigh and put it back down. And then lift this leg. Is this one harder to lift? Or not bad?
No, not bad.
Okay, cool. Drop that leg. So I'm going to tap in a few spots with a tapping instrument. And I'm going to mix some technology with some old school stuff, okay? You're going to get everything. I'm going to do all techniques on you. All right, so lift this leg one more time and then lift this one afterwards, one at a time. It should just be a little easier. And then drop that. And then let's bend these both legs. So bend from here. And how's it feeling now? Was it any change, or remember how you said it got tight in here?
Yeah.
Not as much?
Not as much.
Okay. So let me next see if your pelvis is misaligned. So I'm going to put these alignment shoes on you. That allows me just to check the alignment. And you said it's your left knee that bothers you too, correct?
Yeah. Well, it's a little bit. I just want
Yeah. Yeah, might as well let me look at it.
That, yeah.
We do a lot of knees here because I work with a lot of dancers, so they bring in, like, here, take a look with the camera will come in, and we'll see left leg's really pulling short by almost 2 centimeters. So as I bring the legs, let me have these legs, let them relax, and they even out in position 2. Look at this, just pulling down on the medial collateral ligament on the left. So I take this and I pull down, and the leg's even. And I push up, and the leg goes short. And I pull down, and the legs go even. So I'm going to do that correction. Do you feel a little tender in here when I touch this one spot? Let me get the spot exactly. Right there. Do you feel that tender spot a little bit? Well, I'm going to adjust it because it's part of this alignment thing. So I adjusted the inside of the ankle and the knee, and look how different his alignment is already. When you watch this back, you'll get to see it. So now let me just pull down on this hip. That's still off a little bit, but not as bad. So I'm going to push into the bottom of your pelvis. Is that okay?
Yeah.
Okay. It wasn't on strong enough. There we go. There's settings for little bones in the body and big bones in the body, and you need a big bone setting for the pelvis because it's a big bone. And look, it's even. So now I'm going to bring it to position 2. It's even. Now we're going to stress the knee a little bit more. So I'm going to take the top of the tibia and push it forward, and that made the leg go short. So the tibia is too far anterior, and I'm going to put it on a setting that we use for the knee and adjust it straight back from anterior to posterior. Let's recheck it. So I take the top of the tibia and push it forward. It's holding its adjustment. Now I'm going to rotate the tibia, and it does not like external rotation. So let me adjust the external rotation back to the center. Re-stress it. That's fine now. Grab the fibula. Fibula looks fine. Let's check the kneecap. The kneecap looks like it's slightly lateral. So I'm going to put on a very light setting and adjust the kneecap from lateral to medial. So I have the kneecap between my fingers. I adjusted it straight lateral to medial, or left to right in his case. Let's re-stress it. Good. Put your left wrist on your lower back, right up here. That made the leg go short. So we're going to do L5 next. And I'm going to put it on a setting for the lumbars. I'm going to adjust L5 straight down. Recheck. Perfect. Switch arms, please. L4 looks good. Both arms on your lower back. Nice. Both arms to the top of the table. Bring them all the way up. Bring them up here by your face. Here and here. Good. Bring both arms back down. Turn your face to the left now. Any tightness when you turn that way? In the neck?
A little bit.
Do this one. Head back to center. Turn your head to center. And adjust here. And adjust here. Now turn your face to left again. Any looser?
Yeah.
Okay, back to this side. Head back to center. Now turn to the right, see if that's looser. Point to any spot that's not loose. So go to the right, go to the left, go to the right, go to the left. Point to any spot that's not moving nicely. So you reach your hand up and go, right here, it's still tight. Show me.
Maybe a little bit right here.
Good, so back to center with your face. And I'm gonna adjust right into C2. Good, now turn your face and experiment again. Anything change?
Okay. Feels.
Good.
Wow.
What happened? Did it get a little looser?
Yeah.
That's cool, right? And you feel this one right here? Good. So now I'm going to have you crawl to the top of the table. I'm going to do a little bit of a chiropractic adjustment in there, like a pop that you're used to, okay? So I'm going to come into here. Good. Do you hear those crack?
Mm-hmm.
Good. 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 Lie on your side facing me. So your head's gonna go here. You're gonna keep your body straight. Move close to the edge though, so I have a little room to bring your leg. Bend the top knee. Let me have this hand here. I'm gonna release that lower left spot that you talked about, okay? Good. One more. Good. Lie on your back now. You feel that move a little bit?
Yeah.
Good. Now move to this edge. No, but stay on your back. Stay on your back. Good. I'm going to just double cross your arms like this. Oh. Good. Move back to that side of the table. But stay on your back.
Okay.
I'm only going to do one side of your lower back because only one side was really out. I don't want to disrupt what we just did. You're not going to like me for doing this, but I was a massage therapist for eight years before I became a chiropractor. And I know some of this, I learned this before I went to chiropractic school, but a lot of this nasty trigger point work. Right there. Good. So bring that arm back. Good.
Oh, hurts.
One more.
Oh.
Good. So this needs to be done a little bit.
Oh, hurts. Oh, yeah.
Alright.
Oh.
Good.
Oh.
Drop your head. Good. Drop this. There it goes. Nice.
Ooh.
All right, so let's see. Come stand. We still friends or no?
Oh, absolutely. You're gonna be my best friend, like you said.
Come
Oh, I
stand.
need.
Come stand. No, stand up. Move that shoulder, that left shoulder up. So we need to work on this a little bit. Like, I know you have a good chiropractor, so you might want to stay with that person, but if you do want to come in to see me, I would probably work on this as part of the package. I would work on your left lower back, I would work on your left knee more, I would look on your whole spine, but I also work on some of the trigger points there. I think this is a size ball you should get because it's really good for the lower back, but you could also work it on your chest. So this is a 5-inch ball. The one that I bought was called the Orb. I found it on Amazon, and it was like 19 bucks.
Okay.
But we use lacrosse balls a lot in here, which are small, but this is good for the lower back. So what you do with the lower back is you put it right where that QL is. Here, look over here on the thing. So you're gonna put it down in this space above your hip and below your ribs. So when you lie on your back, it goes right in that spot,
Oh,
and then you keep your leg long on that side. So it stretches over like a rainbow. Here, lie on it right now. Put it on your left side. So it's not gonna be the center, it's gonna be slightly left of center. And bend this knee. And just know it feels 50% more intense if you're on a hard surface.
Right.
I would not do it on a bed.
Okay, so you have to do it in a hard surface.
Yeah. You wanna try it on the floor real quick?
Yeah.
Good, so try it on the floor. Because I do it on the floor at home. I have a little tiny,
Well,
like I have a
most
yoga
of my
mat.
time- yeah.
So this, you wouldn't do it during the golf, it would be that night when you
Okay.
get home.
Okay.
Or if your back's tight, you would do it that morning before you head out to golf.
Okay.
Okay?
So do I get my body on it?
Yeah, and then bend this knee. And this one goes long, like a rainbow over the
I
spot.
see. And I keep it like that for
Yeah.
how long?
I don't know, till you're done. Till you feel like it worked
Couple
pretty
minutes.
good. Even 1 minute is good.
Okay.
But move up a half an inch, down a half an inch. Find the worst spot. Where you go, oh, that's my spot. That's what you're looking for.
Oh, so I have to be on a spot.
Well, otherwise you're wasting your time, right?
Okay,
So you're looking for pain. You're
I
looking
see.
for tightness. You're
I
looking
see.
for a messed up muscle that needs a little work. So what I like about this is, let's say you play golf, you get home, your back's a little stiff that night.
Right.
So then lay on this for a minute. You can have a glass of wine on the floor right next to you. This is not exercise, this is just laying on this. Or you wake up in the morning, you're stiff, you want to play golf that morning, you maybe lay on this for 5 minutes before you head out the door. And it'll just open that up. The other thing you could do, which you don't have to do right now, but you can lie face down so it's on your shoulder.
Oh,
So
I
you're
see.
lying on the floor like this,
Oh, I see.
and you can move your
Okay.
arm every which way.
So basically every spot that hurts.
Yeah, but this would be lying on your belly
I see, yeah.
on the floor.
Mhm.
And then you move your arm however you need to. But
Okay.
if you work that, you wouldn't need to see me as much.
Okay.
Otherwise, you come to me and I'll work it.
Okay. I'll be
Um,
back for sure.
Thank you.
Great, thank you so
All right,
much.
thanks. All right, appreciate
Thank you.
it.
Thank you.